I'll just do a brief introduction. I hope this is current. If it isn't, talk to Sangi after the meeting. Yes, I do.
He said that the meet's correct.
Oh, he said, okay. So, John is the director of the National Institute on Disability, Independent Living, and Rehabilitation Research. It's a long I, for those of you that still remember your grammar school, grammatical stuff. It's a NIDILRR, not NIDILRR, NIDILRR. Like Bette Midler is Midler. This is Bette NIDILRR. John earned a graduate degree at Macalester College in public policy. He's a big policy guy, which is so exciting because I love policy. I don't know anything about it, but my good colleague Amy Raworth is heading up the whole policy and advocacy initiative at Lakeshore. So we have these very interesting conversations, and obviously there's a big need for policy and access to health, wellness, and to get physicians to be thinking about the life after rehab. So John also worked at a place that I knew about years ago called the Courage Center in Minnesota. I think they changed the name, didn't they? Sister Kenny? Right. Yeah, Sister Kenny. So any of you who are Catholic, you remember Sister Kenny when you went to confession? No? Okay. we'll bypass that one. He was at the Courage Center for 14 years, leading nonprofit rehabilitation service providers, where he led a public policy and research team that focused on defining and achieving better outcomes for complex populations. His team received one of the first Healthcare Innovation Awards distributed by CMMI at the Centers for Medicaid and Medicare. And with that, I'll turn it over to our cleanup hitter, John Tschida.
So I'm going to mix my metaphors here and turn away from baseball for a second. As a parent, you're not supposed to have favorites when your children, right? You're not supposed to vocalize them, especially in a public setting. As a research administrator, you probably shouldn't pick favorites among your grantees, but being here with this team, it's impressive. I've always been a big fan of Jim's, but this combination of high-quality research, the strong commitment from the academic institution, and the partnership with the foundation, you just don't see that across the country. If I could take this show on the road and do a little advocacy of my own, it would be impressive. Dean Jones, the financial commitment, not just the financial commitment, but the philosophical commitment to this work, very impressive. So kudos to these guys as I just watched strike one go by and hit the catcher's mitt. Jim's work, if I could just stick with that for a little bit, and he mentioned my work at the Courage Center. His research really was foundational in having us build then a 2,000 square foot rehabilitation and exercise facility for individuals with disabilities. And this Courage Center, just a thumbnail sketch, it's a community-based organization. It's a nonprofit, was the largest nonprofit rehab organization in Minnesota. It wasn't attached to a hospital. It really was community-based. And like the Lakeshore Foundation, it's a social gathering place for individuals, as much as it is a place to provide the opportunity for increased function. If we look at Jim's transformational continuum there, it's the restorative piece that they do there, but they also do the community-based and the prevention piece, which is on the far end of the continuum. As a result of that research and my advocacy efforts and that of a couple other people, we did get that fitness center built, and it's been of great benefit to thousands of individuals with disabilities in the Minnesota community, and that combination of opportunity to better yourself that has both physical and mental health benefits in the same place where you can meet with your buddies and have a social gathering place. Those 6 elements, providing an incentive and retention for individuals to participate in a fitness regimen right on, and we saw it there in spades. So again, an impressive bunch of folks, and it's been great as NIDILRR director to continue to support that work. Margaret has been mentioned a number of times here. I also want to recognize my other NIDILRR colleagues over in the corner here, Bill Schutz and Steve Bauer, who are also involved in this important work. Jeff mentioned our mission, which is very similar to the UAB mission. And it's really to generate new knowledge and promote its effective use, not just for its own sake, though. I think the most important part of our mission is what comes next, and that's to expand society's capacity to enable individuals with disabilities to lead full and active lives. It's a part of the Rehabilitation Act of 1973, and it's really that expanding society's capacity that's not just important to me, but that really gets us beyond the research for its own sake. And how can we influence the community? How can we influence not just individuals with disabilities to provide them with clinical interventions and other interventions to better their lives, but how can we use it in a translational sense? And Jim talked about translating these results, which is absolutely critical. How can we use knowledge translation once the science has determined what's going to work for what populations? How can we get that information into the hands of the people who can really make a difference? As some of you may know, our program transferred from the Department of Education to the Department of Health and Human Services. There was some level of trepidation among our staff when that happened. I think it's going to be the best thing that's ever happened to the organization. We have just joined the Administration for Community Living, which is a strong service and program organization. They also have an advocacy function. And Jim met with a number of the staff there yesterday, I believe, to talk about this translational science piece. How can we take interventions that have been developed and tested for one population at the research level, either expand that in terms of size to determine if efficacy remains the same, or move it to different populations, and how can we expand that science to prove that it will work for multiple populations within the disability community. So we have a tremendous opportunity based on where we are to take the important work that you all are doing to bring it to different audiences, to not just expand the science in a way that's going to benefit more people, but to then take those results to talk to our partners at CMS, to talk to lawmakers on the Hill, to really move policy and reimbursement in a way that will provide additional incentives for people with disabilities to do the right thing in terms of taking care of themselves. And as I age, Jim's work is much less theoretical and much more physiological as I recognize the need and, frankly, the development of some of my own secondary conditions that aren't welcome at all. So I have newfound incentives to make this very personal. And we all know it's the right thing to do, right? Who among us has a benefit as a part of our employer-based insurance to go to a fitness center to optimize our health? You don't see that necessarily in the public programs that are funded out of CMS. Yes, there are pockets of creativity around the country, and Minnesota is one of those places where we're seeing the use of Medicaid waiver benefits to pay for fitness services so that people don't have that financial barrier. Some of the others may exist: transportation, time, weather, what have you. But if we can eliminate that financial barrier, if we can prove the efficacy of these programs, to take the important work that you all are doing to CMS to get reimbursement, I mean, that's a win-win for everybody. It's going to help us to achieve the triple aim at the federal service level of lower cost, better quality, and high value in terms of the customer experience, all critically important. So I would love to spend the full day here with you. I'm going to have to duck out in the middle of the day, but I'll be back for the tail end. But really taking the challenge of fitness and wellness for people with disabilities with the opportunity of technology and everything that you're going to talk about today really creates a world of possibilities, not just for the end users and individuals like myself living with disabilities, but the possibility of that critical policy improvement that's going to meet the goals and the strategic imperatives of multiple constituencies. So I thank you for the work you're doing. Thanks to Jim, to the Dean, and to the Foundation for the great work that they're all doing, and look forward to a productive and action-oriented day.
Home run. John's a busy guy, so we really appreciate him being here today. And with that, we'll go ahead and start the program.
I just want to point out the fact that Jim, when he grew up, I'm trying to remember which stadium it was in. He sold concessions and shades, walking up and down the aisles, hawking stuff. So I thought that this was quite appropriate for him to be